My name is Commissioner Frank Avila, and the name of our show today is How Does the Environment Impact Our Health? And as our guest today, I have Dr. Kenneth D. Thompson. He's on the faculty of Department of Pathology at the University of Chicago. And he was a formal full-time doing research, but now he's teaching and doing research now. And I brought on an expert on how to wash hands and what it means to be washing hands. And we're going to talk about also the good bugs and the bad bugs, antibiotics. Thank you for being on our show.
Well, thank you for the invitation.
Oh, thank you. You know, washing hands. You know, we're reading in the paper that everyone is getting sick now. We go to the doctor, he takes our temperature, takes our pulse, and writes out a prescription. And we go and go to the pharmacist and get a prescription, and we intake. And we also eliminate that through our human waste, flush it down the toilet.
We do.
It goes into our sewage treatment plant, and at our sewage treatment plant, we may not treat that pharmaceutical drugs. So if we get 10 people getting sick, and we have 10 different prescriptions coming through our wastewater plant, and we don't treat it, and those 10 prescriptions, the compounds in those prescriptions may combine and form a different compound that may simulate other things that may affect our body. And so I saw, the reason why I brought you on is because I saw that you had a hand washing week day. I forgot what was the word, but how to wash your hand week. And that's why you're here on the show, to explain to the public when to wash your hands. Okay, when do you wash your hands, Ken?
Well, cleanliness is an important aspect of all of our lives, and hand washing is one of the aspects that we need to pay attention to. If you're not in any particular industry like healthcare, hand washing is still important. So, you know, you wash your hands. I wash my hands many times a day. But certainly, we wash regularly, especially if we come in contact with something that may be infectious. You would want to wash your hands. Getting your hands dirty, that's an indication you should wash your hands. If you go to the bathroom, washing your hands. Preparing food, before you prepare food, you need to wash your hands. But there are many aspects of our lives where hand washing and cleanliness is an important aspect for preventing illness.
Yes, you know, and the reason why I mentioned that is that I called, I think, the Soap and Detergent Association out of Washington, D.C., and I asked them if they'd like to be on the show, and they recommended you to come on the show. And so that's why I said you were the expert in how to wash hands and explain why it meant to be washing hands. So Thank you, Soap and Detergent Association out of Washington, D.C. Now, what to use when washing your hands? You know, and as I mentioned, we treat wastewater.
Right.
And we're telling the public, or I'm telling the public, Commissioner Avila is telling the public that you don't need to buy the antibacterial soap to clean your hands, because it's not going to clean your hands, I believe, as clean as buying ordinary soap.
It's even worse than that.
Right. Explain why. Because of the compounds that are in your antibacterial soap that is harmful to the environment. It
may be harmful to the environment. I don't know how many studies have been done on that, but just regular soap and water, and the mechanical part of washing your hands is important too. So just soap and mechanical rubbing and warm water will take most of the organism, bacteria off your hands. The problem with the antibacterial soaps is they have compounds in them.
There's two, right, that we're concerned with?
There's
tricyclosan.
Right. And that, what happens is you select for resistant organisms, okay? So if you're continually using it, you're selecting on your skin. We always have bacteria on our skin. The organisms that are going to be on your skin are now resistant to that compound. But what's worse than that is that people have been looking into the fact that the resistance mechanism to that compound may carry with it resistance to a whole array of other compounds, including antibiotics.
Yes.
So by using antibacterial soap, you may be selecting for antibiotic resistance.
So you mentioned antibiotics.
Right.
That's one of the key ingredients also, yes.
Right. So I don't know how much work and studies have been done in this regard, or how many bad outcomes have been reported, but I do think it's something we need to pay attention to, and I discourage people from ever using, in their home,
Yes.
using antibacterial soap.
And, you know, unfortunately, when you go to the grocery store to find ordinary soap, I might be on the top shelf or maybe at the bottom shelf way underneath, because all the soap that you see out there, antibacterial soap.
Right.
And unfortunately, we don't very find much of that ordinary soap around anymore.
But it is something that we should pay attention to.
Yes.
But again, hand washing is
you
important.
know, we intake water, we intake liquid in our body through our mouth. But people have to realize that what we put on our skin, our pores, takes in a lot of liquid. Our pores take a lot of liquid into our body. I don't know the percentage, because I know I drink a lot of water. But what you put on your pores, if you cannot put anything on your pores that you cannot put in your mouth, maybe you shouldn't put that on your skin. What do you think about that, Ken? Is that a good thing or not?
It depends, because the situations are a little bit different depending upon where you work. You're right. I mean, you may be putting things on your skin that are, harmful, not only to your skin but also to the organisms on your hand. And we want to have the good organisms that are living on our hand. They prevent infections. But now, if you're working in the healthcare industry like I do, you may be working with bacteria, and you don't want to ever take them home.
No, the health. What do you mean by the health industry? What, hospitals?
Hospitals and those kinds of facilities.
Facilities, yes.
Right, and it could be nursing homes or hospitals or even daycare centers and those places where you may come in contact with in crowded conditions and may come in contact. And so there again, there are a number of products, but the alcohol-based detergent, alcohol-based hand washing material is something that I find to be the best in most situations. Not all, but most situations. But there are certainly others. And regular soap works pretty well too.
Regular soap. And you mentioned about just washing your hands and thoroughly rubbing back and forth. Should one do it for 5 seconds, 10 seconds, 20 seconds, or an hour, or how long should one do it?
Again, it may be if you're a surgeon and preparing for surgery, you probably want to do it for a long time. But for regular situations, you want to make sure that you're washing the hands for at least 10, 15, 20 seconds and rubbing them together with soap and running water on them, because just rinsing them isn't helpful.
Yes. Washing your hands, the article that I read was the survey. It was sponsored by the Soap and Detergent Association. They had a group go out and observe and record how many people were washing their hands after they went to the washroom, right? And it gave a percentage, and I think the men and the women were about the same, but the men, I think, had a little higher rate of not washing your hands, and compared to the women.
This is a problem for most. Well, it's certainly a problem in the hospitals and healthcare facilities. People need to wash their hands. But you're right. There was a study done by the infectious disease physician. They also looked at infectious disease physicians who were at a meeting, and whether they washed their hands after using the bathroom. Yeah. And the men were worse than the women, but I think it was less than half of them washed their hands.
Yes. And you have to wash your hands before you eat, after you throw out the garbage, before you take care of a sick person, and after you take care of a sick person. I mean, there's so many times that you should wash your hands that we're not doing it. And let's say you sneeze. You sneeze, and a friend comes by, and you shake his hand, because there's how are bacteria transfer from one person to another. Could you explain, Ken, to the audience?
I sure can. A lot of, organisms on our hands and so forth are sometimes transient, but they certainly can be transferred from one to another by hands. And we know this in the hospital when people don't wash their hands and carry organisms from one patient to the next. And we can trace that, and we can look at markers on there. We know that that is occurring. Now, you mentioned sneezing. Respiratory virus season is coming up, and so hand washing is part of that. We do get viruses by people coughing and sneezing as well. So if you're in a crowded train or bus or, where there's lots of people and people are coughing, it's not just your hands. I wish it were just that simple. If you always wash your hands, you wouldn't get a cold or
Yes.
a flu. But, of course, they also travel through the air when people cough. So covering your mouth and covering your face when you cough and sneeze, or in some cultures, in the Far East, they wear a mask. It's sort of socially unacceptable in this society to wear a mask.
Oh, because we're a high-class society.
Right.
We're the #1 industrial country.
Right.
Why wear a mask?
Well, but I think we just are sort of offended by somebody wearing a mask. We don't know whether we should be afraid of that person because they have a mask. Maybe but I think, so it's not been acceptable, really. It's never been. But other countries do wear a mask when they have a cold.
Yes, so cleanliness, they say, is next to godliness. So now I know why they made that statement. Is that and you mentioned maybe people get sick during the different seasons of the year, and you mentioned we got spring, summer, fall, and winter. And maybe in winter, that's why more people get sick during the wintertime.
They do. The whole healthcare industry charts, especially influenza and in children, respiratory syncytial virus. We look for specific organisms and colds, and we can predict that every winter around Thanksgiving, probably from Thanksgiving to the end of January, we're going to have a peak of influenza. It's like clockwork. It always occurs. And respiratory syncytial virus, a disease of children, we see it starting now, November, December, January, February, March, and then it goes away. And it's very serious in kids. So it's why these things occur in winter is not known, but they do.
Now, have you done any research on that?
My research has not. I mean, we do track this, and we report all of our findings to the Center for Disease Control and World Health Organization. So we do that. It's not really part of my personal research, but it's research for the institution and the laboratory.
And what is your personal research that you're doing?
My research is I invent drugs. I make
Invent drugs?
Drugs. These are antiviral drugs.
Antiviral. Now, as I mentioned, I'm the commissioner at the Water Reclamation District, and we treat wastewater. So when I hear about pharmaceutical drugs or personal care products, a bell rings in my.
What is this?
What is this, or what kind of compounds, what kind of ingredients we have in this type of product? Because, as I mentioned, when it comes to our sewage treatment plant, we may not treat the compounds or the ingredients in the personal care products or in the pharmaceutical drugs, which is going to be harmful to the environment. And now we're talking about global warming. We're talking about pollution. We got a whole slew of other things out there that we have to be concerned with: cancer, heart attack, mental illness, and everyone is getting affected by all of this, sir. And now we're, and they all need prescription drugs, and they all use personal care products. Right. And so I'm glad. So when you say your research is on pharmaceutical drugs or prescription drugs? Or?
I wish they were pharmaceutical drugs. They're actually more. We're just making them and testing them. These are antiviral drugs, but they're specific for sexually transmitted diseases.
Okay, which is important. Which in Africa,
right?
AIDS. One of the biggest deaths going around now is AIDS.
Right. These are drugs that are targeted for sexually transmitted viruses like herpes, cytomegalovirus, and AIDS or HIV, and it would be for preventing transmission. So that's the sort of the model that we're trying to make.
Now, you mentioned about antibiotics, which is being used throughout the whole world. Overused, and do prescription antibiotics, okay, alter our normal floral bacteria?
They do.
They do?
They do. And so when you take these, people should remember that just because their child has a cold, they shouldn't take them and get a prescription. I mean, they really should be for a specific, because most of the colds are virus, and the drugs that they're getting are not for the viruses. But when you take them, when you ingest them,
yes,
if you have an infection, when you take that drug, it may kill and treat you, and you will get better. But it also alters a lot of the other bacteria because we're covered with bacteria on our inside and also a little bit on our outside.
So we have the good bugs and the bad bugs in ourselves.
And the good organisms are there for a reason, and they sort of prevent the diarrheal diseases and so forth. So
the bad bugs.
The bad bugs, right. So taking antibiotics is not without risk, and so we see a lot of what is called antibiotic-associated diarrhea because it alters the flora in your gut, in your GI tract.
Now, antibiotics, they give this to human beings, correct?
Right.
Where else do we see that? Are they giving it to other? Are they, as a human being, we take antibiotics, unfortunately, for a lot of things that we don't really need. But are they giving it to anyone else besides a human being?
Right, and you'd probably be surprised to know that there are more antibiotics given to food animals, probably.
Food animals? And why do they give it to food animals?
They give it to food animals because it makes them gain weight faster.
And the food animals that Dr. Thompson is mentioning could be a pig, chicken, cattle, because he says it brings them to the market faster.
Right.
Because the end result is that if one has a business, got to make a profit. How do you make a profit? If you put it to the market, have that cycle, put it to the market faster. So the antibiotics will make them bigger. But as a human being, we'll eat that animal, that food, right?
Right.
And what would that do to us? Let's say I have a cold or I'm sick. I take an antibiotic. I'll go out and I have a good steak that has antibiotic, that was given antibiotic. So I'm having my antibiotics from the prescription, antibiotic from the beef. What would that do to my system?
Well, it could affect you, the antibiotics, but the food animal industry is sort of restrictive. They take the animals off antibiotics a few days before they come to market, so it lessens the amount that's in the food. The problem is when they are feeding food animals antibiotics, they are selecting for antibiotic-resistant bacteria. And so when you hear about E. coli and specific strains of E. coli, they are selected for by giving those food animals antibiotics. And it contaminates the meat, and when you eat it, you may get sick with this specific strain because of the antibiotics that are used. Now, there are countries in the world that have banned antibiotic use in food animals. And so I think there will be pressure for people in this country too to rethink the use of antibiotics in food animals because of the problems that we see associated with it.
So you mean here in the United States of America, we're considered the #1 industrial company in the world. We're a world power, and yet we have countries in Europe that may have a better policy on antibiotics.
Yes, it's true. I mean, Denmark, for example, has banned the use of antibiotics in animal feeds for a number of years now.
Denmark. Now, are they better educated than us?
I think.
Or what is it about the Americans compared to Denmark? Because we think we're the most educated, scholarly people on Earth.
Well, I don't know that there's the information is available to all of us, so we're not unique here. They have done studies to look at this, and of course it's a much smaller country, maybe a little more homogeneous society, probably closer from the farms to the market. We have a big country with a lot of space, and so the issues are a little bit different here, but the food animal industry has been very strong lobby in maintaining the antibiotics in the animal food. And but things change, and I have hope that we may rethink this.
Well, there is a big movement out there about eating organic food, organic farming, using animal food with no antibiotics, and so it's growing, and the only way to change it is maybe through our farm bill. I mean, our farm bill should have a paragraph in there, maybe set aside conventional type of farming, conventional type of livestock raising, to organic, give them some kind of subsidy, so we could maybe see the change from that type of farming or animal raising to organic, because these type of farming may need subsidies, because we're always talking about a profit. I mean, that's the bottom line.
Right, that's the bottom line.
The bottom line is making a profit.
You can't be in business and lose money. So you're right. Farmers who, if they can't make it, are going to go out of business. So you're right. I don't exactly know how this would work and how we could convince the public health or the food animal industry to stop promoting this. But it would be it's going to have its downside too, because they're not going to make, they're not going to come to market as quickly, and so the revenue is probably going to be different.
Oh, yes.
But I think it would be good for our health because of all the, the infections that we can trace to food animals.
Now, we talk about pigs, animals, and chicken. Now, how about fish? What are they doing? Are you familiar with anything about fish?
Well, they do. I'm not familiar with any problems, but they do have fish farms.
Yes, fish farming. Yeah.
And fish farming is a huge business, and it's growing.
Yeah.
And I don't know this. I don't know about how they treat. I mean, they do concentrate the fish in a very small area, but I don't know whether they give them antibiotics or how they work with them.
Well, there's a fish farm here in Flanagan, Illinois, that does some type of organic type of fish farm, and we're going to have them on our show.
Oh, okay. So you'll get a
first-hand information.
Right.
Now, and this is why there is a need more for funding research to our universities to do more research in the subject that we're talking about.
Right. I mean, certainly the wastewater, what happens in those situations is really poorly understood. I don't think people are looking at that, and certainly alternatives to using antibiotics in food animals would be another area that certainly could be used. And studied well too.
Well, I think now the industry now is starting to look more into this type of research because they're finding a lot of environmental hazard towards this type of farming, and so now they're doing they're saying we have to do more research, and that's why I'm saying that our government or corporate or whoever provides this type of funding, we should provide more funding for it, and you know, we have to rethink, because I don't know why Europe and other countries are doing more, are funding more in research, where here in the United States we don't fund this type of more fund in this type of research.
Yeah, I don't have an answer for it. I think the lobbies, maybe they have better lobbies, or maybe the politicians are better informed. I don't know the answer to why they do, but they do.
Now, you know, we're talking about antibiotics. We're talking about washing your hands, and one thing that I think we have to talk about is that how to prepare food. You know, because the next thing besides washing our hands and antibiotics, getting sick, is that for a human being to survive, we have to drink water, liquid, and we have to eat food. And do we eat it raw or do we eat it cooked? And I think the majority of us eat it cooked, unless you're a vegan. They eat raw vegetables. And so how do you prepare food? And so, and you know, so we don't get infected.
Well, we have to be, cleanliness, as you mentioned, is quite important. The foods that we buy may be contaminated with bacteria that are harmful to us. So, like things like salmonellosis. Salmonella is a bacteria that causes diarrheal disease. Now, because of the way animals are taken to slaughter and packaged, quite often, especially if you go down to the local grocery store and pick up a package of chicken that's uncooked, just packaged, and culture it, you may find salmonella there. So it may come with the packaged material to your home. So you want to make sure that a couple of things. You wash your hands before you start working with it. And once you're through working with this packaged material, you want to make sure you wash your hands again. And any boards or any countertop that have come in contact, you want to make sure you wash that. And then you want to make sure you cook it thoroughly. Because if you cook it properly, the salmonella will be killed.